Hey, Dr. Steve Battaglino here. I wanted to share with you some x-rays of a patient that came in after a car accident. She had some neck pain. The neck pain went away pretty quickly, even though you could tell there was some injury there, and we can see it on x-ray. I'll show you in a second. But the pain went away fairly quickly after like 3 visits, and she discontinued care. Then shortly after that, she ended up moving away and moving back 5 years later. So I started seeing her 5 years ago after an accident. She was in her early 20s. The pain went away real quickly. She moved away. 5 years go by and she moves back. So she came back recently. She's having neck pain again, where it's kind of getting worse. And we took another x-ray. So if we see the comparative study between the before and after x-rays, called the pre and post x-rays, we can see some changes. The pre, or the before, is on the left-hand side of your screen. So this is the jaw here. The curve here is actually supposed to go the other way. It's supposed to go like this. You can see she had a whiplash injury where, you know, those ligaments that hold the neck get stretched a little bit. It's like a sprain injury. And there's some injury to the discs when that happens. The discs are in between the bones, here, here, up here. And so, like I said, the pain went away pretty quickly, but then she discontinued care right after that, and it wasn't completely healed. How do we know that? Well, when we took another x-ray, this is just last week, this is the post x-ray or the after x-ray, we can see this same area. So if you look here, look at the disc here. Looks nice and fat in the back. And we look at it here, and you can see that there is bone spurring. The disc has gotten much thinner. It looks like these bones are getting really close together. So what's happened in that 5 years is that disc wore down and became dehydrated and smaller, and the wear and tear caused these bone spurs to form. The problem was that the bone didn't really get back into its proper position completely in a way that the thing could heal up completely. So the pain went away. The patient unfortunately assumed that it was healed up completely because the pain wasn't there, and you know, we're just human, so you know, something else comes onto your plate and you start thinking about a million other things that are more present in your awareness. So she failed to get that fixed completely. So now she's in her late 20s and we're trying to get this area fixed, which it'll heal to a point where it won't bother her, but it won't heal completely, because you see now you got these bone spurs that are going to be there for the duration, and it becomes more of a, you know, the goal becomes more just getting this to heal the best that it can, and kind of just maintaining it at that level and trying to keep those bone spurs from getting worse. So just a little tip for you to continue care a little bit past where the pain goes away, because that doesn't, you know, the pain goes away, you're taking that thorn out of your foot. It doesn't mean that it's healed completely. It needs time to heal up after that initial pain goes away. This is Dr. Steve Battaglino. This is your Health Minute. It's probably more than a minute. Have a great day.